Turning now to heart attacks. We told you this week about comedian Rosie O'Donnell thought she might be having a heart attack, but she waited 24 hours before she went and saw a doctor.
And she's lucky it wasn't too late. And in talking with others, we realized many times there is no pain in the chest, and symptoms can often be confused for the flu, maybe even a toothache. So we've asked Dr. Diane McAllister to come talk more about this. Thanks for joining us.
Oh, sure thing.
So first, let's talk about the symptoms, and we know they can vary as well between men and women, right?
Right, and in men tend to get the more classic symptoms, which are crushing, pain in the chest, shortness of breath, pain going down the arm, up the neck, and cold sweats. Women, on the other hand, tend to get more vague symptoms. They get pressure pain anywhere in their upper body, and they can have just a feeling of fatigue, malaise, just not feeling good at all. In fact, the biggest heart attack I've ever seen, my practice, the woman came in with ear pain.
Really?
Wow.
Yes.
You know, we hear people talking about their teeth hurting, their arm.
Right.
So if you start feeling some of these things, do you quick pop an aspirin? Do you dial 911? What do you do first?
Well, I would dial 911 first and take the aspirin after you get done talking to them, and because it's life-saving to do both.
Okay, so good things to keep in mind. All right.
Yes.
And you don't want people driving themselves to the doctor, right?
No, absolutely not. There's two really good reasons. The first is the most common reason for death in the first part of a heart attack is lethal arrhythmias of the heart, where the heart beats in a normal rhythm, and the people in the ambulance have defibrillators and can take care of you right away. The second is, we say time is muscle. So when you come to the hospital, they actually do EKGs in some of the ambulances, call in, and we call in our cath lab team while you're still on the way in, so we can get you straight up there and open those blocked vessels.
Yeah, so the time is of the essence. So you see cases all the time, I'm sure, where there may be not a heart attack. What tests are done when you get to the hospital to determine if it is or isn't?
Well, as I just said, the EKG is the first test, and it can show heart attacks. But we also do a test called troponin, which is a blood test that helps detect damaged heart muscle. We also go to the cath lab, and the doctors and team put a catheter into your vessels and shoot dye into the heart vessels and can actually see the blockages. If it's more indeterminate and it's not definitely a heart attack, some people are starting to do CT angiograms where they do a CT scan and actually can see inside the vessels. It's pretty cool.
Wow.
We know some people are maybe predisposed to having a heart attack because of genes, lifestyle. So what do we need to do to prevent it?
You know, prevention really works, and we're seeing the mortality rate and the incidence of heart disease go down. So, number one, go to your doctor. They can do things like test your cholesterol, because even if you don't have a family history, your cholesterol can be off. And also, there's a thing called a CT scan where they do calcium scoring, and they just do a CT scan and look for calcium blobs in your heart, and that's been correlated to a risk for heart disease and stroke. Then beyond that, we can all exercise, diet, eat low-fat diets, and we should be having certain tests done, such as thallium treadmills, if we have certain symptoms. But really, you have to talk to your doctor to find out which tests are right for you.
Is family history a consideration here?
Family history is a huge consideration, and people can do all the right things with the family history and still have heart attacks, so those people are followed in a different way, which is why you really have to talk to your doctor about what sequence of testing you need.
Just be aware.
Yeah.
Exactly.
Important information, possibly life-saving information.
Exactly.
Thanks so much, Dr. Diane
You're welcome.
McAllister. And if you have a topic you want to see discussed, you can email 11am@thedenverchannel.com. You can also click on Staying Healthy and scroll down to see our doctor's special section.